we too often just accept our fate as martyrs and, not being believed. And it, it's exhausting. It's exhausting. After the third specialist you've gone to and told your same symptoms to, you just don't want to tell it to anybody else.
Yeah.
So, that's where, a lot of the model in my practice comes from is it's based off of trust. Like, hands down, off the bat, I trust you. I believe you. You don't have to prove your symptoms to me.
Yeah.
You don't have to try to convince me. Like, whatever you tell me you're experiencing, you are experiencing.
Yeah.
And we're going to figure out why. And we're going to figure out what we need to do to get you feeling the way you want to feel.
Welcome to Lived In by Zoe Therapy Services. I'm your host, Micah Faye, and I'm excited to share with you a community of experts who specialize in helping you feel fantastic. That's what Lived In aims to be, an online hub for DIY wellness led by the experts and curated by folks who care. In this wellness series, I interview Richmond community leaders, vendors, and healers to empower you with a toolkit, one filled with healthy practices to make every day just a little bit better. So welcome to Lived In, your online comfy couch surrounded by friends and supported by experts. Come on in. We're excited to have you. Hey everybody, and welcome back to Lived In. I'm your host, Micah Faye, and today we are here with Jacqueline Boone, who is a functional medicine nurse practitioner, and she's going to tell us all about what that means today. So, my dear, hi.
Hi.
What I would really like to know is if you could explain your practice to me as though I'm a fifth grader.
Okay.
Okay.
Yeah. So I guess the first thing to start with is I'm a nurse practitioner, and I've learned that some people aren't actually familiar with the role of a nurse practitioner. So nurse practitioner is a nurse with graduate level training and education, and we are able to assess medical conditions, to order and interpret diagnostic testing, make diagnoses, develop treatment plans, and implement treatment plans and follow up patients. So some people might see a nurse practitioner as like their primary care provider or as a specialty provider. So that's kind of, structurally the role that I play. My business is Blissful Heart, and we're an integrative medicine practice for women. So my goal is really to focus on helping women find true, deep, lasting health and healing without guilt, without shame, and without shadows of their past traumas. So I intentionally use the term integrative medicine because it's truly integrating the best of all available therapies, the best of conventional and alternative practices to find the solution that's going to help the individual person in front of me. So we focus a lot on like nutrition and lifestyle changes. It's a lot of education, a lot of really working with women to help them take back ownership of their bodies and their autonomy, and really understanding what's going on, why they're feeling the way they're feeling, why they're having these symptoms, learning to trust what their body's telling them. And then we work together. It's more of a partnership on like, hey, you tell me what you're struggling with, how you're feeling. We, of course, do lab work and use some diagnostic tools to kind of figure out the underlying problems. And then we develop a plan together and try to make that really realistic and sustainable. And, it's kind of a partnership throughout the whole process.
Yeah. Well, I have about 1 billion questions after that. I think firstly, when you say functional medicine, can you give me like a short, sweet, comprehensive definition of what functional medicine is? Yeah.
So functional medicine is a framework in which we look to optimize the function of the various systems in the body.
Okay.
So rather than look at individual parts like your respiratory system and your musculoskeletal system and your GI system, we look at the function, how these different things function in the body. Because in reality, you can't really separate your left arm from the rest of your body. And you can't separate the physical aspects from your emotional, spiritual, mental health. You're one person.
Right.
So we have to look at all of those aspects. And it's a shift in how we think about health and illness. So, traditionally we kind of say, unless you are diagnosed with this disease, then you're healthy. But health is more than just the absence of disease.
Right, yeah.
You can not meet diagnostic criteria for a disease and still feel like crap. And that's still a problem. Like, we still want to address that.
Right.
So we're really looking to optimize your health, optimize the function of your body through a systems-based approach, and trying to find and treat the underlying root cause of your symptoms or your issues, rather than just put a Band-Aid on symptoms.
Okay, so then the way that you talk about your practice, there's a lot of shared experience. So we make a plan and we try to make it realistic. That seems really different to me than any doctor I've ever been to. And my primary care doctor is a wonderful woman who's maybe the first doctor that's ever listened to me in my life. But I don't feel like we make a plan. Can you tell me what that looks like practically?
Yeah, so it's when I started this, I want to actually really help women feel better.
Yeah.
And so it's not enough just to say, okay, here's these 15 things you need to do. Good luck.
Yeah.
If you can't actually implement those, if those aren't actually realistic, it doesn't matter. I haven't helped you. Yeah. So, I spend a lot of time. The appointments are much longer than your standard office appointment.
Right.
And we talk a lot about where you are in your life. Everybody is in a different place and has different capacity for stuff. So, the things and the way that I would recommend addressing the same complaints to a mom of 3 kids who also has a career outside of the home and is, versus somebody who maybe has grown children or doesn't have children and has more time to put into stuff. So it's not just the time constraints, but it's also looking at kind of emotionally, spiritually, how prepared are people or how ready are they to adopt these kind of lifestyle changes? How fast do they feel like we can work? So, the fact is, I may have spent years in school and lots of training understanding physiology and understanding disease processes and understanding medications and supplements, but you're the only person that has lived in your body your entire life.
Yeah.
I'm not the expert in your experience. You are. So I think it has to be a partnership. You have to say, yeah, I think I'm doing okay with this. I'm struggling here. This seems easy. So that, we figure out together, we know where we're going to go, and what path we're going to take to get there is just an individual conversation that I have with my patients. It's because you should be informed. It's your body. It's your body and it's your health, and that should be something that that you're yeah, this feels good. I'm doing okay with this intervention, or I tried this thing, or this is really hard. I just can't seem to get into a habit of doing it. And so we try something else.
I think in our previous conversations, just sort of ranting about the way women are treated in health, there just seems to be this sort of shroud of mystery around what it means for a woman to be well. And we know that that's largely a systemic issue, right? We're still not researching the female body in the way that we research the male body, right? So I'm curious, how do you peel back those layers of mystery for women to feel at home in their own bodies? I don't know. Can you help me?
Yeah, absolutely. It's the things that I've picked up on is I realized even though we can have all the knowledge and the things to do, okay, I know what kind of things I need to eat. I know that I need to exercise. I know I should sleep and I should drink water, and most people know those things. So why don't we do them? What's in between point A and point B?
Yeah.
And as I work more and more with women, and also from my own experience, at the core of it, if women don't believe that they deserve to be well, that they deserve to take care of themselves, if they don't believe that they are just worthy of that self-care and taking that time to do these things for themselves, even with all the knowledge, you're not going to do it. And those are very deep issues and very deep-rooted issues that we have in our society that take time to work on. So I'm kind of working on two levels. Like on one level, it's like, okay, I want you to focus on drinking water, and that's what's going to be our goal, and we're going to help you do that. But we're also having conversations little by little about, these things with self-worth and deservingness and shame and trust. Women are kind of programmed from a very young age to have a lot of shame around the female body and around our female organs, around our menstrual cycles. And we also are kind of programmed to not trust our own experiences.
Yeah.
That we have to get validation from some outside authority or expert before it's true. Like somebody else has to say, oh yes, that's what you're experiencing. You're correct. It's not enough just to say like, I'm having this, I feel chest pain. Like, oh no, it's probably just anxiety. It's you're probably just depressed. Right. Hysteria. This goes back hundreds of years in kind of brushing aside women's complaints and women's bodies. And there's huge gaps in medical research. There are huge gaps still within the medical system itself. In underrepresentation of women in general, and particularly women of color. It's unbelievable. We've made a lot of progress, but we have a lot more to go.
Yeah.
So I really, my passion really lies in helping to get women to get to that place that they really have deep love and respect for themselves, for their bodies, that they trust their symptoms, that I get them to tune back into that. And it's using, the knowledge from understanding how the body works, how our hormones work, how our neurotransmitters work, how all this ties in together. Like, you're not crazy. You're not making this up. You have these symptoms because we know these processes in the body work this way. Like, your symptoms are your body's way of communicating to you. And we just have to start listening to those, tuning back into that. And so I try to do that in, there's some activities and different exercises and things that I will have women do. And I also, when we're checking in, my first question is, well, how do you feel?
Yeah.
Like, how does that feel? Oh, well, I'm doing great. I've lost 10 pounds. My first question is, okay, well, how do you feel?
Yeah.
Like, how's your energy? How's your sleep? How are your bowel movements? All that, getting back to focusing on your experience in your body, and to trust that and know that is of primary importance.
I think every woman kind of has like a horror story set in a hospital. I know I definitely, I have several, but I think the one that stands out the most to me is my appendix tried to kill me. And I was sicker and in more pain than I've ever been. And you have to bear in mind, I used to train horses for a living. So I've never been on like that level of pain. Yeah. So I drove myself to the hospital, right? Because I'm a lady and that's what we do. And I get there. They first accuse me of trying to get painkillers, that clearly I'm just a slut off the streets trying to get a high. They finally take me back. They tested me for pregnancy 7 times and claimed I had an ectopic pregnancy twice. Finally, a woman comes into the room. She puts her hand where my appendix should be. I punch her because that's the level of pain that I'm in at this point. And she's like, appendicitis. It's appendicitis. Yeah. And they have to ship me to another hospital where I am taken care of. This is 8 hours after I had gone into the hospital with appendicitis. Like I could have been dead. Yeah. And they would have been claiming that I had an ectopic pregnancy. Yeah. Like the only thing that can be wrong with us is somehow connected to our reproductive organs. It's and of course, but every woman has this story of being treated this way in hospital settings. And I know just from talking to you previously that your experiences like these have really impacted your practice. So can you just talk me through your journey, how we got here from your own longings and fate and experiences?
Yeah. I'm sorry that you had that experience, and you're absolutely right. I like every woman that I've talked to has a similar interaction, which is like shocking. My husband, on the other hand, does not. He actually said to me, he was like, I don't think I've ever had anybody question like my symptoms. I don't even like, and I was like, yeah, that is my point. Yeah. So I started working in the hospital setting in critical care, and I enjoyed that. And it wasn't until I kind of was on the other side of the bed rails as a patient. I mean, I've always had an interest, and early on in my career was interested in functional medicine and kind of more preventative health, and had been like going down the podcast rabbit hole with all of those things. When I got pregnant with my first child and I like had my kids, that was really the first time that I was on the other side. And like you said, a lot of the women's stuff, we get like reduced to just our sex organs, and like being pregnant, like then you're no longer a person, you're like just a shipping container for somebody else. And it really was astonishing to me, like how much I was like, I had to fight for my own autonomy and for my own wishes about stuff to be like listened to and trusted and respected. And I went on and I had a couple other kids and had like similar experiences with all of those. So throughout that, I ended up getting diagnosed with Hashimoto's, with autoimmune thyroid disease, and caught that pretty early on. I worked with a functional medicine practitioner after, being told that everything was fine. I was just tired because I was a new mom and, kind of being brushed off. Maybe it's postpartum depression, and like, no, there's postpartum hair loss, and then there's
what you were experiencing.
I am going to go bald. So yeah, I was on track with that. Then I had a scary experience. I was kind of starting down the path of wanting to do this business, and I was still working in the hospital, and all of a sudden, I was feeling so tired. Like, I remember looking at the floor underneath the desk where my computer was, and I was like, maybe I can just lay down there just for a minute. I felt so tired. And it was like 1:00 in the afternoon. I thought, I'm going to have to get coffee because I still have 6 more hours in my shift. Like, this is ridiculous. So I walked down, got my coffee. And as I was standing in line to get it, my legs started kind of shaking, and I was having a hard time like standing up, and I had to use the handrail to get back to the office. Like I couldn't pick up my feet all the way. It was the strangest. I've never felt anything like that. And even in that moment, I was thinking like, what is wrong with me? Like, am I making this up? And, like, I even was questioning, like, in the moment that I'm having these like scary symptoms, like, am I faking this? Am I making this up? Like, and I was like, no, like I can't, my feet feel weird. Like there's something really wrong happening. And I got back to the office, and my coworkers looked at me, and I was like, guys, there's something not right. They wheel me down to the ER. They're like, you're done working. Like, you're going. I was working at the time, like 6 hours out of town, in a city 6 hours out of town. So they did like my initial workup. I had weakness in both legs, couldn't move them normally, didn't have normal reflexes. I was pretty scared that there was something serious going on, maybe MS. If you have one autoimmune disease, you're more likely to have another, just some other kind of scary stuff. So they did initial testing, did scans, consulted the neurology folks, and said, well, there's nothing on your scans. We can discharge you and you can go home so you can follow up with neurology at home. So my husband had to come up and get me. I still didn't have any answers, didn't know why. Nobody could explain to me why my legs weren't working. And I still couldn't walk. So we got in the car and drove home. And on the way home, I was calling, trying to get in with a neurology office. I couldn't get in for 8 weeks. I called my primary care, and she's like, yeah, just come right in. I'll see you. As soon as we got there, and she saw me, and she was like, why are you out of the hospital? Like, you need a spinal tap. You need, they should check CSF. You need to go back. So she sent me back to the ER, and I had all my records. I had gotten all my records. I had the images on disc. Went back to the ER, sat in a waiting room for 11 hours overnight. Finally got taken back to the room. They repeated some scans, did some extra scans, did more blood work. And meanwhile, this is like 24 hours. Like I have 3 little kids at home.
Yeah.
I can't use my legs. I don't know what's happening with my body. Nobody's really communicating with me. And I know from working in the hospital setting, like I know there's people like actively dying there. So I'm trying not to be a burden or not to impose, not to ask for anything. And the curtain to my room was closed, but the door was open, and I could hear the team talking about my case. And then I heard them say, typical ER case looks like faking. And I just, like, I could feel my blood boiling.
Oh, yeah.
I could feel the steam coming out of my ears. And I was like, faking? Faking? They think that just for fun, that I just want to come sit in an ER for 13 hours and not even ask for so much as a glass of water. Like, it's not like I was like, oh, mainline me some morphine, like I asked for nothing. I asked for nothing other than for you to try to figure out what's going on with like why my legs don't work. And basically because my symptoms didn't fit neatly into some diagnostic box, I must have been making it up. Like, and I remember thinking like, they know that I'm a nurse practitioner.
Right?
They know that I am a medical professional. Like here I am with all of this privilege and I'm still being dismissed like this. Like, how the hell are you treating other patients that aren't, like, I know to what questions to ask and how to advocate for myself in the medical system, and I'm still being dismissed like this. Like, how many other people are being sent out in what kind of condition?
Yeah.
It was mind-boggling. And when the nurse came in to check my blood pressure, like shortly thereafter, and I was like, you probably don't want to check that right now. It's going to be bad. And I told her, like, I can hear, how do you not know that I can hear everything that you're saying?
So you
like,
said you did say something.
Oh yeah.
Good.
Absolutely. It's like, how do you guys not know that like patients can hear you at the nurse's station?
Yeah.
And so then, they tried to say that maybe I misheard, maybe no. So first I'm faking and now I'm having auditory hallucinations. No, I know what I heard, and it's super unprofessional and offensive that you think that I just have nothing better to do. Like, so they discharged me. That was when I said, like, there wasn't any apology. There wasn't anything. It was discharge. They brought me discharge papers, and I hobbled my way out and sat on a bench and called my husband to come and get me. So my primary care is wonderful, and I had gotten a tick bite like a few days prior, and I told them all of this info. Like I ran a half marathon 2 weeks ago. I did have a tick bite. So my primary had sent me a script for doxycycline, which is the antibiotic to treat Lyme disease. And you can have neurologic symptoms from Lyme. It's atypical, and we have very poor lab testing for Lyme disease. It's very, very misdiagnosed.
Yeah.
Because we just don't have good labs to show. You have to go a lot of times on symptoms and excluding other things. So, I mean, the good news was, it wasn't MS. There was no big lesion. I didn't have some kind of tumor on my brain or my spinal cord.
God.
But, 48 hours after taking the doxy for the Lyme disease, my symptoms were gone. So it, and I remember sitting there thinking, like, this is why I am doing this business. This is why I'm doing it.
Yeah.
Because it's such an awful feeling. Like the people that you're reaching out to for help are just dismissing you. It's, women, I truly believe that by healing women, that whole, loved, nurtured, powerful women are these incredible powerhouses for change in the world. Yeah. And we too often are just accept our fate as martyrs and, not being believed. And it, it's exhausting. It's exhausting. After the third specialist you've gone to and told your same symptoms to, you just don't want to tell it to anybody else. Yeah. So, that's where, a lot of the model in my practice comes from is it's based off of trust. Like, hands down, off the bat, I trust you. I believe you. You don't have to prove your symptoms to me. Yeah. You don't have to try to convince me. Like, whatever you tell me you're experiencing, you are experiencing. Yeah. And we're going to figure out why. And we're going to figure out what we need to do to get you feeling the way you want to feel.
Wow. Yeah. I think having a female practitioner, the first time that I told her that, I mean, again, I trained horses, so I have a lot of broken bones and just like a lot of pain. And I think I told her that I get cold sores from actually a medical malpractice incident when I was a kid. And she didn't blink. She just was like, cool, I'll send in the prescription. What? Then I was like, I have chronic genetic migraines and they debilitate me. And she's like, what do you take? And I said, Imitrex. And she said, can you afford that? And I was like, not really. And she said, I'll send in for the generic brand. Seconds. She didn't even say like, are you sure you have migraines?
Yeah.
She was just like, okay, what do you take? Where's your pharmacy?
Yeah.
And that was day one of meeting her. And I've never in my life.
You're like, wait a minute. I don't have to like give you all of my evidence. I have to pull out my folder and show you.
My portfolio of all the times I've blacked out from migraines. No, she didn't. She just was like, here, go get medicine. And you want to know what? Since she prescribed me, I haven't had to use it. And I think like being believed might have made a little bit of a difference. Yeah. I don't know. So what do you think needs to change other than the entirety of the way that our medical system is set up, obviously? But like, what do you think? How do you think that more people can do what you do, I guess is my question.
There's definitely a lot of work that needs to be done on a systems level. We are making progress in nursing. Nursing has largely been a female-dominated field. Medicine has largely been a male-dominated field. And while that is improving, female physicians still tend predominantly to go into like primary care and OBGYN specialties. There are still certain specialties that are that don't have equal representation in having females involved in the organization. And that's true with, the governing bodies and the, school, like the educational and medical educational system, having females in leadership roles there. Yeah. So that's all kind of more long-term stuff. But a lot of these things, I think I try to focus on education, and I really want to do more community education, because there's a lot of stuff. It doesn't take fancy high-tech solutions. Like the things that we end up doing are really simple interventions. Yeah. It doesn't mean they're easy to do or to implement or maintain, but they're simple. Like that is accessible to everyone. And I hope to be able to kind of work to find community partners and different ways of bringing like healthy food and making that more accessible. We have all of those issues with food deserts and lack of access to fresh produce. Buying fresh meats and vegetables is more expensive than buying packaged and processed stuff. So there's definitely still work to be done there, but I think that education and helping to empower women about their bodies and teaching them how to advocate for themselves, how to ask questions. Yeah. Even if they can't work with a functional medicine or integrative medicine provider one-on-one, there's still a lot that we can do with education and empowerment and just kind of handing the keys to your body back to you. There's a lot of work with, regarding pelvic health and regarding education around our menstrual cycles. And a lot of that, I think, could be started a lot earlier in helping women not have all of the shame and guilt around that. That feeds into like other parts of your life. Yeah.
So what's something you want all women to know about going to the doctor? One skill you want us all to have, maybe?
I would say trust in your body, like trust in yourself, trust in your experience, and know that what you are feeling and experiencing is real and matters and is important. It's very difficult because there is this like power gap, like when you're going in, that they're the authority and you're the patient. So it's even hard. I've talked to women that are like, I'm going to go in and I'm going to advocate for myself. And then you get in there and, it's a 10-minute appointment and there's not much time to ask questions. And you're like, okay, yes, thank you. and you end up like not saying it. So, you deserve to have a partner in your healthcare. And so you've got to find somebody that kind of jives with you, that's going to take the time. Don't be afraid to shop around. Get second opinions, especially if there's, if there's a real diagnosis of something serious or something's going to require a procedure or an intervention. Get a second opinion. Ask questions. Ask about what are the alternatives? Okay, why are you recommending this thing? What are the alternatives? What's the risk if I do it? What's the risk if I don't do it? Because that's, you have the right to have true informed consent about your care, and we kind of that gets glazed over a lot. It's kind of like, here, do this thing and go away. So yeah, just, you do the best you can to advocate for yourself, and then don't beat yourself up about it if you don't speak up, because there's a lot of, that's a lot of pressure when you go in.
Yeah. So how do, our listeners, but also just people in Richmond in general, how do we know when to come see you? Who are candidates for your care?
Yeah, so I work with adult women. I don't see children, and I have ended up consulting with a few husbands of some of my patients. But and this is women, people who identify as women, regardless of your gender identification or expression. I help on multiple levels. So some people come to me because they are pretty healthy and they just are looking to optimize their health, and they want to maybe do some functional lab testing. They want to do food sensitivity testing, or, look at tweaking their probiotics or something like that. I really work a lot with women that have a lot of kind of vague hormone symptoms, fatigue. They have terrible symptoms around their cycle. They have hair loss. They have a hard time losing weight. They're trying all these other things and nothing's really working. And maybe they've asked their primary care doctor and they get some labs, but they're told everything is normal. They get referred for therapy, or they get put on an antidepressant, or they get put, and some therapy is wonderful. I think everybody should have therapy personally, and antidepressants are needed sometimes, but that shouldn't just be a way to dismiss your complaints.
Right.
You really need to look. So, I do, integrative medicine, integrative functional medicine consults for those issues. We also offer IV therapy, so IV nutritional therapy, and we offer that for men and women, again, just adults. And I also do holistic pelvic care, which is a wonderful therapy to address pelvic complaints. So urinary leakage, pelvic pain, kind of recovery after childbirth, and this also, anybody that has a uterus, regardless of gender identification, can have pelvic care. It's a combination of myofascial work and mind-body integration and energy healing that helps kind of get you back in tune with your pelvis and reconnect those neurons firing that this is yours, this is your pelvis. We tend to get very disconnected from our core.
Yeah. I mean, you brought a friend.
I did. Yeah. I show this to every woman that comes in, because it, why was I 30 years old before I actually understood what the inside of my pelvis looked like?
Yeah.
This should, every girl should see this. So, just looking at the pelvis, this is where you feel the bones on your hips and the spine back here. And this is the uterus, fallopian tubes. In front is the bladder and behind is the rectum. So I'm going to pull out the bladder. And so this is why the uterus sits on top of the bladder, which is why when women are pregnant, they have to pee all the time. And this, set this down. So this is the bladder and the uterus. Uterus is quite tiny. This is life size.
You're kidding.
Average woman's uterus is that small.
No matter what size the woman is?
I mean, it'll vary a little bit, but this is average. The average female. This is average female. That thing stretches to accommodate, a human, and then goes back down. And this is the vagina. So the vagina is actually the space between the opening and the uterus. And this part here is the vagina, which is most of us are not taught the correct terms. So the exterior part that we see is the vulva, and the vagina is the passageway between the uterus and the opening. So this, I always show to people because I think it's quite incredible what our bodies are capable of doing. And inside the pelvis, you can see all of those muscles. Like that's all muscle. This whole network of muscles, there's multiple layers here. So just like when you are tense or stressed, you can get knots in the muscles in your back or your shoulder.
Yeah.
We also hold tension in our pelvic bowl. We hold tension in these muscles. Whether you've, carried a pregnancy or not, we hold these tension patterns here. And it can pull stuff, out of alignment, leading to issues with pelvic pain, leading to issues with urinary leakage as we get older, especially after childbirth. All of these muscles are holding the weight of the gravid uterus. It's a lot of tension and stress there. And sometimes as women have babies, as baby comes down the vaginal canal, it can stretch, depending on positioning and lots of things with labor, it can sometimes stretch out this anterior wall, and then the bladder sometimes will sag back a little bit. That's called a cystocele. And so some women will have problems with that. You can, if it comes all the way, down a little too far, and sometimes they'll do surgical procedures to kind of tack that up. And the same can happen on the backside with the rectum. The rectum can come in on the backside of the vaginal wall and can cause issues with incomplete stool evacuation, like incomplete bowel movements, and difficulty with that. The thing with pelvic care, with having some myofascial work done, is just like with your muscles anywhere else. When you get, if you've gotten a massage, like a good massage, it restores, it kind of breaks up that's like scar tissue and breaks up these knots, improves the blood flow, improves the elasticity of the muscle. So you have full range of motion. So these muscles have full range of motion to be dynamic and to move with your body and to help you not pee yourself when you sneeze. So a lot of my friends are like, don't make me laugh, I'm gonna pee my pants. And people like giggle about it, but that's not just your fate for the rest of your life. Like you don't have to just accept that you're just gonna pee yourself all the time. Like you can do things to fix that. That is fixable. That is fixable.
Yeah.
So don't just invest in Depends stock. Like see a pelvic care practitioner, and that, there's various forms of that. There are physical therapists that specialize in women's health and do internal pelvic work. That's, wonderful. And that's kind of know that there are people who specialize in women's health and pelvic physical therapy. The technique that I was taught, I was trained by Tammy Kent. She is a women's health physical therapist, and she developed this treatment called holistic pelvic care, which combines kind of the mind, body, and the physical work. Because it, like we talked earlier, like we're more than just the physical pieces of our body, and especially with our female organs and our pelvis. That's our energetic center. Like that is, a lot of women have experienced sexual assault, traumas. We have a lot of shame and a lot of stuff. So, this work is done with deep respect for the female body, and regardless of gender identification, even if you've had hysterectomy, if you've had ovaries removed, this is still something that is beneficial and can help really restore the full function of the pelvis, restore women's connection to themselves, their acceptance of themselves and their bodies, and it's just remarkable.
Yeah, it sounds really remarkable. You keep coming back to, and I keep thinking about gender identity kind of on the whole. So I'm wondering, do you treat femme-identifying persons that have not biologically transitioned? And if so, how do you, I guess, help situate a woman in a body that she feels like has betrayed her, that isn't her, where she was meant to be? You know what I mean?
Yeah. I haven't yet treated anyone who is transitioning. I have, treated women that kind of fall within a wide range of the way that they express their gender. They're gender nonconforming, women in same-sex relationships. But it's really about, it's all about treating the individual person, and the tenets of helping my patients like really feel at home in their body and trusting and loving their body, getting away from this feeling like your body has betrayed you or like your body is fighting against you or there's something wrong or broken with you. Like, I am broken, I have these symptoms, this thing is wrong with me. Like, no, we like, I actively work to reverse that understanding. Like, your body is beautiful and resilient and wonderful and made exactly the way that it's supposed to be. Like, your body is capable of healing, and it's just responding to the environment that it's in, and we're just going to tune into the signals. So, that kind of deep self-love and deep self-trust and self-care, like really caring for yourself is universal, regardless of what sex organs you were born with and the way that you express your gender identity. And I think it's just that much more difficult for people who are gender nonconforming to find somebody that is going to be like respectful of their experience and of what they need, out of their relationship with their body. Yeah. So it's, I think that's kind of just one of the things that kind of comes with the way that I like to work with people is with deep respect for people's individual experiences, understanding of how trauma physically impacts the body, understanding of that need to kind of have this self-acceptance and self-love, no matter how that's expressed on the outside.
Yeah. Wow. That's really cool. So it should be known that Blissful Heart accepts people of all gender expressions and folks of all walks of life, it sounds like.
Yep. Yeah.
Cool. I just wanted to make that
I can't see kids, and I don't do primary care. I'm not licensed to do primary care. So it is like a specialty service. So I work with people's primary care providers, and I'm happy to, share my notes and talk to them, or, some people are like, nah, don't call them. Either way, however people are comfortable. So
okay. That's really neat. So then my favorite part of hosting this show and doing this project is asking how we can take your specialized knowledge and take better care of our community with it. And you have so much specialized knowledge that at this point, I don't know how you're going to synthesize it for us. But how can I take what I've learned from you today, talk to my neighbors, both metaphorical and physical, and use your knowledge to make their lives better, their health better?
So from the integrative medicine standpoint, one of the lecturers says, to sum it up for nutrition, eat real food, mostly vegetables, not too much. That's it. That's simple. Yeah. The more you can move towards whole foods, actual foods that don't have a label on them, and away from processed and packaged stuff, the better. Drinking water, like on a community and spiritual level, I think, we were not meant to do this alone. We were not meant to go through life as individuals. We were meant to have a community and to have a village of people and of support. And I think the more that we can just try to reach out and create that, the better off we'll be. So I always tell people, ask for help. Just let your pride down for a moment to just say, hey, I could use some help with this or that. And the more that you ask for that, other people will be relieved and they're willing to help. People want to help. Yeah. And then it opens up the door for them to be able to ask for help in return. And we can start to recreate. I know this year has been insane with the pandemic, and everybody feels very, very separated. And, maybe that's highlighting what we miss. We miss community. We miss being around each other and supporting each other. Yeah. So, we can find ways to bring that back and to really value and respect each other and nurture those relationships. So the more that we can do that we can learn that our bodies aren't broken. They are doing the best they can with what they've got, which is what all of us are doing. Yeah. And, there's lots of little things that, little changes can make big impacts. They say, consistency carves canyons. is one of the business mentors. So it's just little changes done consistently over time.
Yeah.
And yeah, your body's capable of healing.
It's really cool. So eat real food, mostly vegetables.
Not too
much. Consistency, carbs, canyons. And your body is capable of doing its job.
Yep.
If you listen to it, I guess.
Yeah.
So then I think we're past our hour mark at this point. I don't know what's going on even. I'm so wrapped. But the floor is yours. What's next for you? What's new for you? What do you want us to know? How do we get in touch with you?
Yeah, so in the office, so we've just recently added the IV therapy, IV nutritional therapy. We have a couple of things to help boost the immune function, so that's kind of popular these days.
What?
So I also have just launched an online course. So thanks pandemic.
Yeah.
I really wanted to I've taken kind of the knowledge that I've gained from working with women one-on-one in my office and have taken the most common things that we kind of have to start with and put it into a 12-week online program.
Cool.
So that can be done, from the comfort of your own home. It does have weekly live group coaching to help on the way. Like, we've put it together so that literally everything you need is provided in the course. It's targeted to busy burnout moms. And like, I have 4 kids, my oldest is 6. So like, I feel you. So we've really put together, it covers nutrition and exercise, mindset, stress, supplements, do you meal plan? Do you not meal plan? Like, all of the things. So we walk you through very reasonable, realistic, manageable, step-by-step things to get people kind of in a really good place in 12 weeks. So that course is just freshly up and running. I'm still doing integrative medicine consults. I do the majority of that virtually, and then just kind of minimize the in-office time just to be safe. And so we can be found on our website, blissfulheartcenter.com, on Facebook at facebook.com/blissfulheartcenter, and Instagram is at blissfulheartcenter.
Wow, really covering all your bases there.
Yeah.
I like it. Well, it was really cool to talk. Thank you.
you.
And thank you for bringing your buddy.
Yeah, thanks so much.
I've never had a guest star.
I love showing off my pelvic model anytime.
Truly, we appreciate it very much.
Thank you. Thank you so much for the opportunity.
And we'll see you next week.